Hi, Dr. Minkoff, LifeWorks Wellness Center. I want to talk to you about sleep. Why is sleep important? Now, in my prior medical career, sleep wasn't important. It was neglected. As an intern, we were working 120 hours a week. So every third night, we'd work all night, and then we'd work the whole next day till 7 o'clock. And that was just how it was. That's illegal now to do it, but back when I was training, that's how it was. And we really didn't have a choice on it. And I learned to sleep not much. And I sort of thought that because my dad didn't sleep much, that was okay. And he would sleep maybe 5 hours a night, and he seemed to operate fine. So fast forward, I got a device about 4 years ago, which is just this little ring. It's called an Oura ring, O-U-R-A. If you're looking for one, it's OURAring.com. And it's a sleep tracker. And there's other methods to track sleep. Some watches will do it, some wristbands do it, but they track sleep. And they can tell you, are you getting enough sleep or not? So when I started to track my sleep, and it gives you a score of how much deep sleep, how much REM sleep, how much light sleep, and how long are you awake once you lay down. And it can get all this information. It can tell you. Most people need somewhere between 7 and 9 hours a night in order to feel rested and get enough sleep. Now, people who don't get sleep, like they've got a blocked airway and they've got sleep apnea, they're sick. They feel bad. They have all kinds of medical diseases. They can get overweight. So we know that lack of sleep isn't good. And we need sleep. Our cells recuperate when we get sleep. When I first put the ring on, and I was doing my 5 to 5 hours and 15 minutes a night, my sleep scores were terrible. So ideal is up to 100. If you're above 80, you're doing pretty good. And above 85, they give you like an optimal, like really good. And I was in the low 50s. I thought, this isn't good. And so I decided I was going to do an experiment and see how I did with getting more sleep. And so I forced myself to turn out the lights at 10 o'clock and to stay in bed until 5. That would give me 7 hours instead of 5 or 5.5. And it took a few months for me to do it. But what I found is that my sleep scores started climbing and my light sleep went down and my REM sleep and my deep sleep went up. And I was able to dial this in. I do take a supplement from Body Health called Sleep. That helped. My wife and I had an electrician come in our house and provide a circuit so that in our bedroom there was no electrical currents when we sleep. So there's no lights, there's no electricity. But I found that made a big difference. And now I'm getting scores, usually 85, 88, sometimes up to 90, almost every night. And I've sort of dialed it in, and it makes a huge difference. Because when you're sleep deprived, you don't feel well, you don't think well, you don't make optimum decisions, and it's very hard on your health. So I encourage people to get some kind of tracker so that they can pay attention to it. And there's some little hacks that you can do. Like cool in the bedroom is usually good for most people. So make the temperature low. If you have television sets and devices with electricity in your bedroom, I would take them out. If you have TV sets that you can't move out, I'd unplug them. Because you want no electrical current in your body when you're sleeping because it causes stress. It causes your nervous system to be on edge. I found that I was sleeping half the time with my mouth open, and I would wake up in the middle of the night with my mouth just completely parched dry. And I read this book a couple years ago called Breathe. It was actually a New York Times bestseller. And he said, you got to breathe through your nose. You're not supposed to breathe through your mouth. So I put a piece of tape across my mouth every night when I go to bed, and I don't wake up with a dry mouth, and it's improved my deep sleep. My wife and I have an agreement. Nothing controversial after 9 o'clock at night. Okay? Like, don't bring it up. No media time, like like Facebook, Instagram. Get off your phone. For me, usually after 8:30. I just turn it all off. And then I have a routine where I'm trying to I'm gonna be asleep by 10 o'clock. I'm gonna wind down. I find that if I go to bed at 9:30, I read a novel of some kind for a half hour or do a crossword puzzle. I get into relaxed mode. I fall asleep. One of the things on the Oura Ring that they give you a red demerit for is if you fall asleep too fast. So if you fall asleep faster than 5 minutes, it gives you a red mark. It lowers your score. And I find that a lot of nights it says 3 minutes and I was out. So I'm going to argue with them on that point because I think that's good. Anyway, there are ways to look at this so that you can improve your sleep, and that sleep is like a holy grail. If you're trying to get health and you don't sleep, it's not good for you. So get your Z's, figure out for you what's needed. I've given you a few suggestions. At the clinic, we actually have a handout with, here's the list of stuff that you can do so that you can improve your sleep, and that improves your health. Okay? I wish you a good night's sleep. Hope this helps.